Okay, take her away.
Okay. Good afternoon, everyone. My name is Doreen Burkhart. I am a nurse at Lancaster Regional Medical Center in Lancaster City. Just as a brief background, I am bachelor's educated in nursing and have my board certification in psychiatric nursing. However, most of my life I worked in the legal profession as a legal secretary and paralegal. So nursing is a new career for me, but psychiatry has always been a passion of mine. So my director asked me to come and participate in this little gathering today. I apologize if I don't have enough folders for everyone. There's a great turnout. I don't know if we had enough resources.
Did anybody not get one? No,
everyone got a folder? Okay. And there are maybe 5 or 6 folders that some of the literature is missing. But as I go over the literature, I can let you know where you can get the handouts that you might be missing if you're interested in them. Now, if you look in your folder on the left-hand side, I've provided, and everyone should have all of these, I've provided 4 articles that I found on the internet, and a brief review of the literature tells me, now because my background's in psychiatric nursing and not in clergy, just a brief review of the literature tells me the role of clergy in the community as far as mental health is concerned is mostly to provide, in addition to comfort and some maybe brief counseling, is to provide resources to the community resources available for someone who might be having a situation. So that's what this packet is designed to do, to help you be armed with the important things you would want to know when meeting someone with a mental health illness or psychiatric issue. So the 4 articles on the left, the first one is an overview of the church's role in the community regarding mental health. And you can read these on your own. I'm not going to go over all of this. But this first one addresses what the different prevention modalities in mental health are as far as clergy is concerned, the primary, secondary, and tertiary prevention modalities, and when you read this you'll understand what that's all talking about. The second one I believe is chapter 11, and if you were interested in more information, the website is at the bottom of the page. There are over 20 chapters in this website that address all kinds of issues on mental health and the clergy. I just picked the 4 that I thought were most valuable for today's program. The second one is chapter 11, and that one I believe addresses, I forget what that one addresses. I don't have chapter 11.
Mentally ill and their families.
Okay, that's the lengthier of the 4, and that goes more into if you were going to be dealing with family members, talking about a parishioner's or a patient in a hospital setting, their issues. The next one is chapter 16, and this may or may not apply. It might just be good information to have educationally for yourself, how community clergy deals with emotionally disturbed people. And then the final one, chapter 25, I thought was very interesting. It deals with training church lay people as community mental health workers. In other words, people in your church that might be interested in being volunteers for the community, that would be, you could train for providing counseling to patients or people in the community. I don't know if any of you go to people's homes from time to time, what different situations come up from time to time. If you get a call that someone wants you to visit, they're having a problem with their children, or I think chapter 11 addresses that quite a bit about what to do in those situations. So those 4 articles should give you probably more information than you want to know about mental health in the community, but hopefully that you'll find that helpful. Now on the right-hand side, here's where some of the information is going to be missing for some of you. But if we'll start in the back, each one of you will have this mental illness booklet, and these are provided by the Pennsylvania Department of Health. There should be a phone number in the back there, or somewhere in there. But online, you can always get this information. Yeah, there is a phone number for ordering all kinds of material from the Department of Health. This is a layperson's quick little reference that if you wanted to have a supply of these to take to a patient's room or their home to leave with someone, this is a good resource for helping people understand mental health, what it is, what it isn't, and try to remove the stigma of the words mental illness. I know everyone's a bit squeamish about using that phrase. It's from the, the past stigma of being mentally ill. People with clinical depression are considered being mentally ill. It's an Axis 1 diagnosis. Axis 1 being the first level on the DSM-4, which gets more into psychiatric stuff that you don't need to know about, or probably don't want to know about. But it's a psychiatric diagnosis, meaning the person has a mental illness. Well, a lot of people might be considered clinically depressed and might benefit from therapy or an antidepressant, but because of cultural beliefs and stigma from the 30s and 40s and 50s that still lingers in the communities, people would be hesitant to ask for help for those types of things. And then we get into the risks of suicide. And so these little pamphlets to kind of ease people into being okay with admitting and talking about their feelings and stressors that might be going on at home, or especially these days now in society, we're going to see more and more people struggling with financial issues, job loss, and we're going to see more and more of people who reach their limit. Their nervous system can only handle, human being can handle a couple of years of extreme stress. And then after, like if there's a death in the family, you'll see a parent or a child or someone who's dealt with the grief and stress of loss or loss of a job, or a dad or husband trying to feed a family, and they'll deal with extreme stress on their own for a period of time until symptoms start arising. They might have physical symptoms that have no physical reason for them, and if they have any hesitation or just really firm beliefs from their upbringing or what have you, that doesn't allow them to address the fact that they've been dealing with a lot of stress and their nervous system is quite frankly shot. And so they need to be able to process what's going on. And there's meditation, there's all kinds of modalities besides medication. Some people need to have medication to help their nervous system calm down to a point where therapy would be beneficial. It depends. Each one is individual, each brain is individual, and in mental health, it is difficult in the sense of with medical, the hearts all work the same, the lungs all work the same, the pancreas all works the same. The medications might work a little bit different from person to person, but with the brain is the brain, it's the organ is what it is, but no two chemical structures are the same. And the medications are not going to work the same from brain to brain, as you would see with blood pressure medication or diabetes medication. You know, with that you want to get the different things regulated, get the cholesterol to a certain level, and you can see that in lab values. With the brain, you can't see that. You can't, the medication, you can only determine if it's effective by the behavior of the person and by the person's report of how they're feeling and how they're functioning in society. Are they able to get up out of bed every day? Those are the questions you would want to ask visiting someone. Their energy level. Are they able to get up and make breakfast? Are they hungry? Are they, able to take a shower at least twice a week? Are they having fun with playing with their children or doing things they always enjoyed doing? If someone's saying, oh, I used to knit my grandchildren's sweaters every Christmas and now all of a sudden they can't even pick up the knitting needles, that's a symptom of depression. And a person wouldn't recognize that. They might gradually just lose interest in things and not give it any thought. So that's when you want to know what's going on that might be causing this. And then that's when you want to have your resources where to refer them to for a more thorough evaluation. And I guess your part would be to try to let them feel comfortable that it's okay. If you were having a racing heart and fainting, you would be okay to go to the ER and find out what's going on. Why am I fainting? Or if you were throwing up all the time, you couldn't keep a meal down, which could be a sign of depression also. And the racing heart could be anxiety. But my point is, if you had a physical problem, you wouldn't hesitate to go to your family doctor or the emergency room, tell them what's going on, ask them what's wrong, and comply with the treatment. Whereas if you are depressed, not enjoying things, not functioning, you might not call anyone. You might stay in bed for a week and stop eating, stop drinking, and then when you start getting dehydrated and malnourished, especially in the elderly, you start to deteriorate, and it all kind of snowballs. It's a domino effect, because now you malnourished or a little malnourished but dehydrated, and the mental status starts to go because it's not getting the proper nutrients it needs to function. So it compounds itself. So I would imagine your role to be helpful with these situations is merely to let people feel comfortable that this is no different than reporting a medical condition to a physical doctor, to call a psychiatrist or a therapist, and that kind of thing. So the red booklet, hopefully yours all say depression on the front and not self-esteem, like mine says. Do they all say? Okay, well, there's one, the self-esteem one is fine, it's more information, but there again, it's from the Department of Health, and you can call the phone number in there again and order the one that says about depression on the front, which is an excellent resource. Do you have some there?
I do.
Yeah. I'm sorry, I put these together at 2 o'clock in the morning, and I did try to focus on what I was looking at, and I don't think I did the best job. But there you have it. The thing is, the resources, the Pennsylvania Department of Health, they have hundreds of booklets on everything you could think of. These are for lay people, they're easy to read, they have illustrations, and this is something you could leave with someone, even the self-esteem one, if that's a problem for somebody. I think we could all use a little self-esteem boost from time to time, some people more than others, so that wouldn't be a bad thing to leave. The other one, this is just something you might want to keep on your desk or wherever, is a little bullet point resource card for the symptoms of depression. Now, not everyone has one of these, and you can get these. Oh, I apologize. I thought I turned that off. Hold on a minute. Whoever that is can wait. Modern technology. You can't get away from the phone. Okay. This has... if you want to write this phone number down for people who don't have this in their packet, This is from the National Mental Illness Screening Project. If you were interested in contacting them for any of their literature. And the phone number is 1-800-573-4433. And they have a nice list on the back of all the mental health agencies that you might want to call from time to time for guidance or information, or to refer someone to. Then I put our brochure in here to advertise our facility, the Lancaster Regional Behavioral Health Services. And there again, you can call the number on the front of this card anytime for information. If I turned it off. How rude. I guess I didn't turn it off enough. Should have left it in the car. Okay. Yeah, so if you needed information and didn't have one of these handouts or couldn't find where to call somebody and wanted just some guidance, you could always call us here.
I have the adult day services handout.
The phone number should be the same. Well, if you call
This is
adult
good
day
for
services,
review.
they can transfer you down to behavioral health. I apologize. Okay, so that's what this is. And this gives a little bit of information about our program and our inpatient mental health department. We do have inpatient for acute, adult, and geriatric mental health. Now, most of you, if not all, should have one of these little Water Street Rescue Mission handouts. Depending on your patient's needs, this will tell you, this you could leave with them if they have needs for housing in the community, food, medical services if they have no insurance. Water Street Rescue Mission has a really nice program and a variety of services they provide for the community. You can call them yourselves to find out exactly what they offer if you should have a specific need for an individual. Okay. There is another simple signs of depression checklist that you can review. I don't think you all have one of these. Now here's a good resource that provides this little checklist if you would want one. And here again, you can order these. This is Mental Health America. You can call them and ask them to send you a box of these to have, so that when you visit someone in their room, you can provide them with this little checklist that they could keep at their home. And Mental Health America's phone number, and I'm going to leave this on the back table. I only have one of these, and this is one of the brochures they provide. This one is on anxiety and panic disorder support groups. That's another important resource to give your people is the support group information. Why isn't there a phone number on here? It's Mental Health America through the United Way. If you call 291-LINC, 291-LINK, they would be able to provide you with innumerable resources as far as handouts on every mental health disorder there is, and there are support groups that meet monthly and weekly on Janet Avenue in Lancaster. This little green handout, now I did photocopy both sides of this. Some of you will have this little bookmarker, and some of you will just have the copy in the back on the right-hand side. It'll be in the pocket there. Right, that's it. And the phone number's on there, and then the different issues they deal with is on there. And this is a good resource to give people for support groups. They have specific women's depression support groups, bipolar support groups, dealing with family problems, children, teenage pregnancy, drug abuse, rape, everything you could think of. They have a support group for it, and they can give you guidance for what your patient might need. But you can also get a supply of these bookmarks to give to a patient. So leaving these 2 things in someone's room, or these 3 things, the Water Street, the United Way, and the Mental Health America Depression Checklist would be excellent community resources for you to leave with a patient in their room or give to family members, or if you should visit them in their homes. Now, I will leave these other 4 resources: the spiritual care offered at Lancaster Regional, the sample of a Mental Health America support group brochure, and then there's one from the National Institute of Mental Health that deals with men's depression, because men, I don't think, admit very easily that they have depression, and so they might have all kinds of symptoms and be at risk for suicide. Men are at great risk for suicide, especially when they reach retirement age, when their lives start to have not have the meaning and the busyness that they're used to, and they start losing friends, and they are the highest risk suicide is white males in their 60s. And so you can get brochures like this to give to family members and parishioners or whomever. And there's also things like this that, and I'll leave this again back there, and this is from the National Institute of Mental Health as well. This is on depression and diabetes, but they have other resources that have information for lay people and consumers about how their medical issues and physical problems might relate to some mental health problems. So these are good resources to have for people. One last thing I'll leave you with. If you're visiting someone and they make comment, or you have any feeling that they are feeling suicidal, or make any mention of, well, if I didn't wake up tomorrow, that would be fine, or make any comment that you're uncomfortable with, that they are sounding suicidal, there's a couple of things to keep in mind. You never want to leave that person alone. If you're in the home, ask them, is there someone I can call, a family member or neighbor or friend, to come and sit with you? There's a phone number I want to give you. You should have memorized or handy at all times. It's the Lancaster County Crisis Intervention Center. It's a 24-hour hotline. They will come to do a face-to-face evaluation. They will talk to the person on the phone and do a phone evaluation and determine how at risk this person is. Do they need an evaluation in the hospital? They will call the police to come to the home if need be. If you're in a hospital setting, you would use the hospital resources naturally, but crisis can come to the room as well to determine if a person needs to be on a locked unit for their safety if they are feeling suicidal. Their phone number is 394-2631. And like I said, they're there 24 hours a day. They answer the phone readily. They'll send an ambulance to the home. Whatever the needs are, they'll try to help you with. I think that's enough information.
Thank you. A lot of good
You're
stuff.
very welcome.
Thank you.
Thanks for having me. Have a great afternoon.